There it is. We're live
Perfect.
here. Dr. Natalia joining us from, are you in New York City?
I'm in Rochester, New York.
Just outside. So you commute into Manhattan?
No,
Or you're done
I am
with
6 hours away from Manhattan. I am not commuting there every day.
well, once every now and then.
Yeah, yeah. I go down to visit every now and then for sure.
Nice. So we have we're connecting here through our New York City connections. She was at Spear Physical Therapy. I was at
Yes,
Star Physical Therapy, and we had a few coworkers combined over the years. We just
yes,
had Dr. Abby Angelis, like Los Angeles.
yes,
And so talking pelvic health. So same topic. I said, who else should we talk to about pelvic health? I want to get this message out there. I actually had a new patient today. There's Abby. Hey, there she is. She says, yay. Hello, Abby, on LinkedIn. So I actually had a new patient today here at home, friend of a friend as well. And yeah, she's been dealing with some pelvic health stuff. Actually had a hysterectomy and then dealing with a whole bunch of hip milieu down the
mhm,
line from C-section scars and all that. And she's shaking. For those not watching, who are going to only listen to this, she's shaking her head, being like, "Yep, I see that all the time." Right? Is
yep,
that what?
yep.
So let's jump into it real quick. Tell us who you are, so where you're practicing now, what led you to this pelvic health thing. We'll get into it.
Yeah, sounds good. So I'm practicing in Rochester, New York. Like I said earlier, I'm about 6 hours away from New York City, Western New York, but I'm not in Buffalo. I'm not getting all that snow right now. Uh, so I opened my own practice a year ago, but I've been specializing in pelvic health for about the last 10 years. I started in that specialty when I was a couple of years out of school, and kind of dove into it. And I think now there's even more information out there for people. I think it's wonderful that it's becoming more and more of a topic. And I think patients are starting to kind of seek that care out a little bit more on their own because they're seeing things on social media, they're reading articles, which I think is fantastic. Um, and so, yes, I like I said, I worked in New York City. I worked for a larger practice here in Rochester before I started on my own in a cash-based pelvic health practice. Like I said, about a year ago, I see women from the full, spectrum, from pregnancy, postpartum, perimenopause, menopause, and really kind of everything in between when it comes to chronic pelvic pain, endometriosis, all of those kind of specific diagnoses. So, and like you said, the hip is involved, core is involved, low back, everything's connected. So,
Hmm.
really cool topic. Yeah.
Yeah, and that's the main thing you're seeing now, or you do some
Yes.
orthopedic stuff in general pop, or no?
No, just pelvic floor. Although I do see some patients that are coming in for pelvic floor, and then I'm like, "I think you have a labral tear," and I will refer them
Mm.
out for surgeries. So a lot of the time, a lot of those things can kind of manifest themselves differently. But I specifically am just seeing pelvic health. Yeah.
Nice. And you mentioned the certification process. I'm familiar with Herman and Wallace,
Yes.
and then the APTA has its own kind of process to get certified. Which one did you go through? What do you think of those concepts? And for the consumer, what can they look for in certifications or that kind of thing?
Yeah. So I went through Herman and Wallace. Went
Abby,
through all of
she might
their.
jump off. Sorry to cut you off. She said, tell her to. She hopes to see you in March at the Endometriosis Summit."
Oh, amazing! Awesome. I'll have to look into that. Yeah. So I went through the Herman and Wallace certifications, and I think that there's pros and cons to kind of either the APTA or Herman and Wallace. I think most people go the Herman and Wallace route, and then there's a lot of kind of subspecialties in terms of education that you can kind of continue to do with them, which is fantastic. So yeah.
Awesome. Yeah. So for the consumer, if they're, can they just Google pelvic health PT in their area and maybe find somebody who specializes in that, and then
Yeah.
that should be good enough.
Yeah, yeah. I think, of course, you can get a board certification through the APTA. In They have a WCS Women's Health certification. I think some people go so far to that route, but I think, as physical therapists, as long as we have that knowledge base and have gone through that coursework, like I said, with either one of those, through the APTA or through Herman and Wallace, you can really start practicing and treating that population. So for a consumer, just Googling and searching, I think Herman and Wallace has kind of a list. You can go on their website, as well as the APTA.
Love it, love it. And yeah, in terms of educating the public, and was kind of our third topic on your list, but I wanted to jump there kind of in this part of the
Yeah.
consumer education piece of and Abby kind of touched on this as well. So I'm curious what your answer, if it differs at all, is um how do we differentiate between pelvic health PT, regular PT, and then even an OBGYN? Because when I bring this up, it's again, I see a woman, low back pain, hip pain, whatever the pathology is or presenting symptoms are. And I'm like, hey, have you heard of pelvic health PT? And I'll usually ask, like,
Hmm.
have you had kids, C-section, natural, whatever? And then, yeah, any kind of painful sex, peeing, pooping problems, any of that stuff.
Hmm.
But a lot of times they're like, what's this pelvic health? What? PT or pelvic floor? I'm familiar. I've heard these words. So give us a little bit of your take on the differentiation between pelvic health PT and OBGYNs and just a PT who might be able to speak to these concepts.
Yeah. So I think, when it comes to all the things that you're describing, when it comes to painful intercourse, incontinence, constipation, all of those types of things, um, pelvic floor health can really help with those things. And I think it really spans beyond a lot of the physical stuff. I think it spans beyond, hey, go ahead and do this exercise. I think we're really big on diving into habits, things you can kind of do day to day to kind of improve those symptoms. And I think when it comes to OBGYNs, I think they're fantastic at delivering babies, endometriosis surgery, whatever their specialty is. But then I think there's a lot of gap when it comes to someone's coming in saying, hey, I had 3 kids and I pee my pants when I jump on a trampoline. And they're kind of like, okay, they don't really, there's that knowledge gap where sometimes it's like, well, okay, I don't really know what to do about that. And that's where pelvic floor can really come into play. Same thing when it comes to, I mean, the most common things we see, like you mentioned, painful intercourse. They're going to the OBGYN, they're like, okay, use more lubricant. But, as a pelvic floor PT, we can really kind of dive in and figure out what exactly is going on physically in the pelvic floor. And I think once again, there's a misconception where it's like, okay, just do Kegels. Is that what this is? And I think that's kind of um, even for other providers, like you mentioned, OBGYNs, it's like, okay, is it just Kegels? And I think it's much more than that. I think what I tend to see is there's a lot more tension in the pelvic floor rather than weakness, or sometimes we need to address that tension first before we're going to dive into sequencing coordination of that pelvic floor. So I think, when somebody's coming to you and saying, okay, what is pelvic floor PT? It's just much more specialized in those areas. So if we clear out, some hip issues, some low back issues, but there's still some lingering things going on, along with some of those other specific pelvic floor symptoms, that's where I think pelvic floor PT can really play a big role. Um, I have orthopedic docs that have patients that have gone through PT, chiro, acupuncture, they've had all the imaging, and it's still a mystery. And that's when often they'll refer to pelvic floor PT because it's like, okay, is there something else that we're missing?
Yeah, I don't even wait that long. I have a woman in front of me who has back pain, hip pain, and I'm like, it might present as a very clear labral tear or whatever. I'm still going to do those
Yeah.
tests, but I always say it's to the woman. It's like saying you have teeth and you haven't been to the dentist. It's
Hmm.
like you need to get that checked out. Um, Abby's going to sleep. She wants to say good night. Good night,
Bye,
Abby.
Abby.
um, so, and then I wanted to do a quick shout out to my wife who just published a book, and Abby I know has used that book and given it out to a lot of patients as well. She's a sex and relationship therapist on the
Oh,
psychology
awesome.
side, and her book is called The Integrated Guide to Penetrative Disorders for Women, and lot of vaginismus and fun talk
Hmm.
there. Very good bedtime reading. Abby might be reading
Right.
that to go to sleep. I don't know. Um, but coming back to you, so one of the first topic I want to talk about is stress and the pelvic floor. You mentioned kind of jumping on the trampoline and peeing yourself, that kind of thing. Give us an idea of again, what women should be aware of when it comes to stress and the pelvic floor.
Yeah. So like stress incontinence, of course, is something when it comes to, it's one type of incontinence, coughing, sneezing, laughing, jumping, running, and you're experiencing leakage and incontinence. So that's kind of one way that stress to the physical body can affect that pelvic floor. Very often that pelvic floor can't absorb that shock. Very often we think, okay, if I'm experiencing that, I just need to do more Kegels. But sometimes, if that pelvic floor is too tense and tight, it doesn't actually have the ability to absorb that shock when we're going to do those. Those things are going to create more inner abdominal pressure. Like I said, coughing, sneezing, jumping, running. Um, and very often, then people will experience incontinence. So it's important to kind of figure out why are we having that stress incontinence. Then the other part of stress, and this kind of goes a little bit more into kind of the mental emotional aspect, is that if we're carrying stress, if we are stressed out at work, at home, overwhelmed, which I think a lot of people are, um, we're going to carry that in our physical body. We know that as PTs, right? We're going to carry it in our jaw, in our neck, but very often we're also going to hold that tension in the pelvic floor. And I think a lot of people are holding that stress in their body and maybe not even realizing it. So that's a lot of the work that I do. A lot of the time, the first few sessions is a lot of breath work. And I always say to people, you didn't come here just to have me teach you how to breathe, but this is sometimes where we need to start. And of course, I'm not a mental health therapist, but I like to kind of talk through how to kind of manage some of that stress in their lives so that they aren't holding it in their body. Like I mentioned, jaw, neck, and tension. If you're clenching here, you're likely clenching in your pelvic floor too. So those two areas are very closely related.
Yeah, and I think you're the fourth or fifth pelvic health specialist I've had on here. I guess not including my wife. But one question that I haven't actually asked, and we've talked about Kegels before, is a little bit of it's sometimes over prescribed
Hmm.
or poorly done, and it's not necessarily evil, but it's finding like any other exercise, like our deadlifts bad. Deadlifts can fix most back pain, but in my opinion, but most people
Hmm.
just don't know how to do them, and it's guiding you to doing that right, finding the person, the expert who can help
Exactly.
you do that right. So my other question though is, I know a lot of women, especially we're going to talk a little bit about menopause as well. I know a lot of women in that age range go to yoga, Pilates. There's a lot of talk about sucking your belly button to your spine, which drives me a little crazy.
Hmm.
But in terms of activating the core, do you find, is there any? I'm just curious, and again, for those participating in those activities, is there anything to look out for? Cues? Do you find when you see somebody who's a diehard yogi or Pilates person, anything connected, correlative,
Yeah.
observational?
Yeah. I think a lot of the time they are very focused on that core stability. I actually just did a talk yesterday at a bar studio. And so, they're all about like the pelvic tuck and really like drawing in through that core. So I'm very big on, okay, let's untuck, let's relax that pelvis, let's get some pelvic mobility going on first, just kind of globally, and let your belly relax. Like, let your belly relax. You don't need to hold all that tension there because the other piece of it is, as you know, it's like that core is a cylinder. So we really need to be able to work on pressure distribution. If we have too much pressure intra-abdominally, that's going to press down onto that pelvic floor. If we're holding too much pressure down in the pelvic floor, that could cause more intra-abdominal pressure further up through the abdomen too. So it's a lot of it is coordination and sequencing. Like you said with deadlifts, I love that as an exercise for great glute activation, core activation, pelvic floor activation too, but it needs to be sequenced properly, right? People need to know how to properly breathe when they're doing that because we can just go and do an exercise, even like a bird dog, for example. I always tell people you can just lift your arm and leg, but if you're actually engaging that core and that pelvic floor the way that you should and then relaxing them, that's really where we need to be because I think like you said, it's not that the Kegel is a bad thing, but it's like, can we contract those muscles and then we do we actually know how to relax them? Because in function in laying on a table, Okay, contract, relax, that's fine. But what happens in function? What happens when the foot hits the ground? When you're running, when you're jumping, you're not going to be thinking about that. So, what is that pelvic floor doing? Can it absorb that shock and then support those internal organs and support the core, support the hips too?
Love it. Is that good for you on the stress, or can we move on to menopause?
Yeah, yeah, definitely.
So yeah, talking about menopause and the pelvic floor, anything consideration? Maybe define menopause for listeners out there.
Yeah, so I think this is just an important topic to discuss because I think, first of all, when we talk about the pelvic floor, everyone has a pelvic floor. I mean, I specialize in women, that's the population that I like to treat, but everyone has a pelvic floor. Men have a pelvic floor. So a lot of these conditions can apply to men as well. I'll kind of say that. But then I think when it comes to pelvic floor PT, a lot of people are like, oh, pregnancy postpartum. And I think we then forget about the perimenopause and menopausal state and how many changes are going to happen during that phase of life for women. So, very often, perimenopause can start um, in your early 40s. We're starting to notice maybe skipping a period. But menopause is really defined as you haven't had a period for at least a year. A lot of the time, people will go to their OBGYN to kind of say, okay, you're in that menopause state. And I think we're all pretty familiar with like the hot flashes and the night sweats and all of that stuff that we tend to see. But there's actually a lot of course, psychological impacts. There's different things that are going to change when it comes to anxiety, stress, as we're getting into that phase of life as well, which is going to, of course, affect the pelvic floor. And then hormone changes. So we're going to notice a decrease in estrogen, which can very often lead to vaginal dryness, so pain with intercourse, and can also lead to some pH changes. And very often, people will experience what seems like a UTI, where they're having urinary urgency and frequency, and they don't actually have a UTI. And very often, that is because of those estrogen changes and the impact that has on the pelvic floor muscle tissues, on the muscles themselves. And so the role that pelvic floor PT can really play in that is, number one, improving tissue mobility, doing some manual therapy, trigger point release, that sort of thing, teaching them how to both engage and relax that pelvic floor, which can also just improve when it comes to sexual activity and also when it comes to um, urination difficulties. But also, of course, I can't prescribe vaginal estrogen or hormone replacement therapy, but understanding the role that that can play when it comes to going through that phase of life. And I think it's just helpful for people in that phase to have that as somebody to be able to educate them on, like, yes, this, here's the research. This is something you can talk to your doctor about. Because it can be very, very helpful at that phase of life. And then I think, of course, the big thing is um, strength, strength training, working on increasing muscle mass, working on improving bone density. And I think getting ahead of that in your 30s before you get into that perimenopause state, so that because that's the other big thing is bone loss and reduced muscle mass can have a huge impact. So exercise, any type of exercise, but there's a lot of research on, you know, more cardiovascular work can really be helpful. There's controversy on whether it's more like high intensity work versus kind of zone two work. But weightlifting and weight training is super, super important. So I think women really need that support on, okay, how do I weight train? I've had a disc injury, I've had this, I've had that. So having somebody in their corner that's familiar with that and can teach them how to properly start into a strength program without experiencing then incontinence and those other types of things that could potentially occur if they're not doing any of those techniques properly, when it comes to lifting and breath work and engaging their core and all that stuff.
Yeah, and my favorite, of course, little facetiously, is women who say, "I don't want to get bulky."
Yeah.
And I say, well, it takes a lot to get bulky. And then, you know, the negative effects of not being bulky are a lot of these negative effects that, you know, women who have osteoporosis, osteopenia, break a hip, all these things down the line. The best way against that is muscle mass. And one of my
Mhm.
favorite, Dr. Gabrielle Lyon, I don't know if you're familiar with her, based in New York City, talks about muscle is the organ of longevity. And she also generally calls what she does muscle centric medicine. So basically, you know, that you can't go wrong getting strong. And the more strength we can kind of build, the more it rises up all the levels of fitness, hormone levels, all these things. We just see the benefits. And if we could ever put all the benefits of strength training in a pill, it'd be a bestseller. It'd be
Yeah,
it'd be a
absolutely.
bestseller. So uh,
Absolutely.
yeah. Any other
And I think
thought? Yeah.
Yeah, I think it also, touching on nutrition, I think, upping protein intake, especially, I mean, I think most women in general need to have more protein. They're probably not having enough. But especially as we're getting into that perimenopause and menopausal state, I think that is a huge component as well, calorie intake and protein, because of those hormone changes, it can be really, really helpful.
Do you give a specific number with protein? There's a few out
Um,
there that I've heard for
yeah, I
sure.
mean, it's like 1 gram per body weight, I think
Per
is,
pound of body weight. Yep.
yeah, per pound of body weight,
Hmm.
is usually what I recommend. But sometimes that's tough for people, so I really kinda tend to break it down, like, "What are you having for breakfast? What are you having for lunch? What are you having for dinner?" Okay, are we getting some source of protein at each of those, and are you getting at least 4 to 6 ounces of that protein? Whether you are, vegetarian, vegan, whatever that is, being able to kind of support people and give them those options, based on any underlying dietary restrictions that they might be following too. So I tend to kind of break it down so that it's manageable for them, and it's not overwhelming either.
Yeah, yeah, and in general, when I talk about that and what I've seen out there is a minimum of zero point 0.7
Hmm.
grams of protein per pound of body weight, up to 1 gram. So yeah, if somebody weighs 150 pounds, it's 105 grams of protein at that zero point 0.7 level, 70%. And then yeah, up to 150 pounds. Woman would be 150 grams of protein a day, which
Hmm.
can be a lot. And again, if you're getting 30 grams of protein, like you're saying, kind of at each meal, 3 meals a day, that's 90 grams. If you're not getting that, then yeah, it's an easy, hopefully, change to make. You can get another
Right.
protein shake and things like that in there. But yeah, that's a huge one for me to bring up. And again, people tend to not like to, you know, there's a lot of myths, and again, with a lot of this stuff, but yeah, especially with the nutrition, it's always a little tricky. So I appreciate that you bring that up. Any other nutritional pieces you talk about with any of this?
Well, that, and then very big on like making sure they're having vegetables, dark leafy greens specifically, and where they're getting those sources. What are you having any kind of fresh vegetables? Because not only for when we're talking about that menopause, but also when it comes to making sure they're passing stool well, they're not, straining or having constipation, because that's of course another topic that I really kind of see, and I see people specifically for that too.
Mhm.
So that's another big one, paying attention to that diet and hydration too.
Yeah, fiber is a big piece, and this episode is actually sponsored by Element. I don't know if you've tried Element. I could send you a
Love it.
little thing. Yep. So I
Love
I
it.
have
Have it every
my
day.
Yep, I have my link for those guys. If it's Drink Element, lmnt.com/fitcare, my business name. So drinkelement.com/fitcare, you get your free bonus pack today in the mail with any order. So Element electrolytes, and especially they do a lot of good understanding research articles about things like menopause, where women going through menopause need that extra hydration. And again, it's an ideal blend of sodium, potassium, magnesium. If anyone's familiar with Rob Wolf, for a long time, the paleo guy, that's him who came up with the company, and I've had him on the podcast a while ago. So yeah, I'm a big fan of all of that for improving hydration and just these little things that people either aren't educated about or don't know, and they can just add it in. Like you said, I have at least one pack every day. Even more important here in Colorado at elevation,
Hmm.
to be hydrated, but important for everyone everywhere.
Hmm.
especially again if you're going through menopause. And a lot of people get scared of salt and undersalt their food and they're low sodium, and then it ends up again having negative effects on the muscle. That's where that muscle centric concept of medicine can certainly come in, as the way I look at it. So, yeah. Any other thoughts on that menopause topic?
No, I think that, I mean, of course, I
Yeah.
could keep talking about it, but that's kind of the gist of it for sure. Yeah.
Awesome. And yeah, we can circle back to that last concept of the folks trying to get more educated and seeking out things based on their needs. So the services based on their needs. So talk a little more about what that means, what that looks like. I mean, I would go so far to say, if especially, so we're kind of focusing on female pelvic health, but I would go so far as to say, if you have a vagina, you probably should see a pelvic health PT,
Yep.
and just have a, like, I again go to the fact, if you have teeth in your mouth, you should see a dentist to just make
Hmm.
sure. I'm on the orthopedic sports side more, but I'm always like saying, hey, this is important. This could be 1% of your stuff going on. This could be 80% of your stuff
Hmm.
going on. And I always say, hey, I'd love to assess you head to toe, kind of make sure your knees, joints, everything's moving well. But as far as again things go with the pelvic health, pelvic floor, I think that again every person with a vagina should be seeking you out. So is that something that you think is worth pushing for, of like a annual screening, or at least a
Yeah.
one-time screening once a
Yeah.
decade?
Yeah, definitely. And a lot of my patients, when they're, you know, graduated, they're like, well, I want that check-in. Let's go 3 months. Let's go 6 months. And get it on the calendar so that that accountability piece as well. But I've seen a lot more patients, especially because I'm in the cash-based realm of things. I think that's how a lot of people tend to find me, because they are already paying cash for other services that they might be seeking out, whether that's massage or acupuncture. They're those people that are kind of um, already trying to educate themselves on that, and like, oh, this is something I should do. So I see a lot of women that are pregnant and maybe not having any back pain or, pubic symphysis pain or anything like that. And they're just like, I just want to come in for a few sessions for labor prep, which is fantastic. We practice pushing and breath work and different positions and all of that stuff. And then I think everybody should do that. And I think postpartum, same thing, come in for a couple sessions just to make sure we're not dealing with diastasis recti. We can work on preventing incontinence, those types of things. So I think more and more people are doing that. And I think, like we said, even in that menopause phase of life too, seeking out another provider that can kind of be in your corner to kind of help guide you through that transition of life as well. So I think more and more people are seeking these things out. I think, especially within this specialty, there's a lot of information out there on social media. Sometimes it's good, sometimes it's not always great, but at least it's getting publicity where people are like, oh, that's a thing. Because when I started in this specialty, I would go to OBGYN offices and they're like, "Wait, what? What do you do?" And I would talk to patients and like, "Excuse me, what?" Now people are like, "Great, internal assessment, like let's go, let's do all this stuff." So I think we're definitely pushing the needle to make this more of kind of a thing like it is in maybe other countries where it's just, everybody gets pelvic
Standard.
PT. Yes,
Yeah.
standard care. Yep.
Any thoughts? Again, I feel we did have one of my pelvic health specialists on. Was actually she specialized in male pelvic health. Any Do you see
Awesome.
any males, or is your practice just pretty 100% close to 100% female?
Yeah, my practice is 100% female. It's just kind of the way that I wanted to kind of structure my practice. I think there is such a need for male pelvic floor health as well. And there's a lot of pelvic PTs locally here that specialize in male. So I usually will refer to them. But I think there's a lot of different topics we can probably she probably dove into when it comes to male pelvic health too. So everyone has a pelvic floor. And I think everyone can really benefit from pelvic floor PT.
Awesome. Awesome. Well, tell folks where they can find you up in Rochester. Any websites, links, anything we can put in the
Yeah.
show notes.
Yeah. So my practice is called Iron Rose Women's Health Physical Therapy. I'm in Rochester, New York. I'm in Brighton, New York. So I'm very central to the city of Rochester. You can find me on Instagram, Dr. Natalia DPT. And yeah, my website, Iron Rose Women's Health.
Awesome. Well, thank you. We're recording this on a Saturday night. Had to work around all the kids' schedules and work schedules, and so
Thank
I
you.
appreciate you doing that. And hope everyone out there got at least 1% better listening to this.